If you think you know everything about in-office dispensing, otherwise known as IOD, you may want to reconsider. The difference between listening versus skipping this live stream may be $250,000 annually. In this video, I'll be discussing a podcast turned article in the March 2024 Reviews in Urology, during which Dr. David Abala interviewed Erica Ferrazzo, the CEO of Idaho Urologic Institute. She's a LUGPA member, and I believe this practice is a single specialty urology practice with 19 providers in it. So I'm going to give you a quick summary, and let's dive into this. For those of you who do not know me, my name is John Lin. I'm a urologist in Gilbert, Arizona, also your humble host of the Thriving Urology Practice Facebook group, where we crowdsource practice management solutions for everyone's benefit, and it is all for free. I like to call myself the modern day Robin Hood, where I steal from the information rich and give it to the time-constrained poor, which most likely is you. All right, let's start. First of all, before we get too excited, the ability to perform some of these things in office dispensing or the certain types of medications that you may or may not be able to prescribe is state dependent. So you're going to have to talk to your state, or I think the purchasing group for urology, specialty networks, should be able to help you set up your in-office dispensing and navigate some of the legal aspects regarding in-office dispensing. So just know that your ability to do some of this stuff may be state dependent. What Erica has done with Idaho Urologic Institute is that they essentially set up a full-blown store in their medical office that is most recently generating about $250K per year net profit. Easier said than done, right? Everybody just shows you the bottom line and the benefits, but it is not without struggle. It is not without concern. Now, keep in mind, you have to take into consideration if you're going to have an in-office store, where are you going to store all this stuff? So space is a concern. Obviously, negotiating with different vendors to get the best deal is also a necessity. You also have to think about expiration. If you have drugs or supply that expire, then you want to make sure you don't lose revenue by having stuff sitting around and expiring. There are also marketing concerns. You have to make sure your staff and patient education pieces and buy-in are in place, etc. So it is not as easy as you think. Like everything else, it comes with a learning curve, and once you overcome the learning curve, the benefits are like an annuity. It is good for the patient, it is convenient for the patient, and is good for the practice. One thing she brought out is that she didn't know that you could have a wholesale agreement from the companies. That means you establish a relationship with these distributor companies and you bypass the middle person. You don't have to pay tax. You buy wholesale price product and then sell at an agreed upon price. So the margin is set, the price is set, and one of the examples would be maybe vacuum erection devices. You can negotiate pricing with vacuum erection device companies. You can also take that concept and apply it to all drug manufacturers from whom that you are purchasing these drugs. Initially, urology practices would purchase and sell oral oncolytics, abiraterone and enzalutamide for metastatic castrate-resistant prostate cancer, and also we would dabble in sildenafil and tadalafil. Again, certain states may not allow you to sell these things, but for a lot of states, you can sell and start with oral oncolytics and sildenafil and tadalafil. Beyond that, what they also have done is that they started selling prostate biopsy prep kits. Yeah, prostate biopsy prep kits. Could be Fleet's enema, could be Levaquin, or whatever it may be, that you would sell to the patients cash. Who doesn't have $20 in their pockets? instead of having them going to the pharmacy, trying to find the stuff that they need, you tell the patient, hey, you've been scheduled for a biopsy. Here's a kit that you need. Here are the instructions included in the kit. Or you can go to the store and then spend all your time in trying to find the stuff that is necessary. Most people are probably going to buy the $20 kit. Also, they sold pre-operative body washes. It could be HIPAA or whatever the body wash that is needed before surgery. That is also another cash item that you can sell through your in-office dispensing. So a lot of us are thinking just drugs, but there are other things that you can sell through your in-office dispensing store, if you will. In addition, if you do a lot of vasectomies, there's something called snowballs, and it's a combination underwear with snow wedge ice packs that you can apply in the front pocket of the boxer brief underwear. And of course, you can buy this from Amazon, but it tends to be more expensive, and there are cheaper options through Amazon. But why not make it easy for the patient? You can purchase directly from the manufacturer and then supply these and sell these directly to the patient. So that's something else that you can consider doing. In addition, now, if you ask your patients with sexual disorder, if you see a lot of sometimes females and males, you want to make it commonplace to talk about sex toys, vibrators, you can call it sexual health device. A patient going to a toy store, if you will, is probably a little bit more embarrassing and not as common, not as easy for the patient to go there. But if it's something that is legitimized by the urology office, which it should be, I hope you're talking to your patients about their sexual health. If it's legitimized by your office, then talking about some of these sex toys and selling some of these sex toys may make it a lot more palatable for your patient that is in your office, and you're suggesting, hey, have you thought about using a sex toy or a vibrator or sexual stimulation device to enhance your sexual experience, to help with easing back into sexual encounters. Also, speaking of sexual encounters and vibrators and sex toys, lubrication. You can also sell lubrication. Now, a lot of patients, they'll tell me that they're using KY jelly, which is water-based lubrication. Now, that wears out very, very quickly if you're actually using KY jelly. There are better alternatives that contain silicone and water-based lubricants combined into one. It doesn't stay around too long, and it's easy to wash off, but it's not too easy to wash off like a water-based lubricant. So you can also sell lubrication in your IOD. Also, if you're like me, you see a lot of kidney stone patients. Moonstone powder. Now, Erica said the gummies are disgusting. So moonstone powder that you mix in water to minimize the risk of kidney stones for your patients, you can sell the moonstone powder through your office, contract directly with the manufacturer, get the best deal you can, make it convenient for your patients, so you are preventing or minimizing the risk of developing new kidney stones by selling them moonstone powder directly. For the ladies with recurrent urinary tract infections, why not sell D-mannose powder through your IOD, right? D-mannose powder is another option for you to sell through your in-office dispensing office. We all know about vacuum erection devices. Also, you can get something called Restorex. Guys with Peyronie's disease or mild penile curvature that you don't want them to undergo plication surgery or Xiaflex. Why not sell the patient Restorex? Heck, it's probably better than vitamin E, which is kind of voodoo. So Restorex, you can purchase from the manufacturer and then sell directly to the patient if you see a lot of ED and Peyronie's. If you see a lot of infertility, you might want to consider dispensing Clomid for your patients who are getting intrauterine insemination, IUI. Selling Clomid, possibly for your male patients who have hypogonadism. You want to preserve their testicular size. And lastly, if you're doing a lot of big whacks where you are doing a lot of urinary diversion, ostomies, you can also consider stocking and selling ostomy belts and ostomy seals for ostomy patients. Depending on your practice, if you see a lot of these patients, it may be worthwhile to you, but keep in mind that these things tend to be more expensive. And of course, like anything else, it is patient demographic depending on what type of patients that you see in your practice. Just like anything that I mentioned in this video is really dependent. It depends on the type of patients that you see, size of your practice, whether or not these things are feasible or not, or possibly not feasible for your practice. So this is the large group, single specialty, 19 providers that is able to net $250,000 annually by engaging in these types of activities through their IOD. You're not limited to the expensive drugs. And speaking of expensive drugs, what about the newer, the nadofaragine, $60,000 per dose? That is really expensive. I'm not aware of anyone who's successfully delivered that to the patients with recurrent bladder cancer. But if you have, please let me know. I would love to hear about your experience. If you have had success with in-office dispensing, or if you have dispensed things that I did not mention in this video, please let me know in the comments. Thank you so much for the privilege of your time. Please take care of yourself and each other. Bye-bye.